Okay.
Okay, pathology mock, station 5, abscess. You can read the station.
A young patient has pain, tenderness, redness, and all features of a high abscess.
So, what is an abscess?
Abscess, focal collection of pus that may be caused by shedding of pathogenic organism into a tissue or by secondary infection of necrotic foci.
Okay. How does it differ from cellulitis?
Okay. Abscess. How it differ from cellulitis? Okay, abscess caused by Staphylococcus aureus. Cellulitis caused by group A streptococci. Organisms in case of abscess, organism secretes coagulase enzyme. In case of cellulitis, organism secretes fibrinolysin and hyaluronidase. Okay. In case of abscess, inflammation localized. In case of cellulitis, diffuse inflammation. Uh, in case of abscess, central zone of necrosis. In case of cellulitis, multiple extensive necrosis. Extensive necrosis. In case of abscess, pus rapid formation, thick and yellow. In case of cellulitis, pus slowly formed, contains RBC.
Excellent, doctor. You answered everything, but I think in all points you no need to mention in case. In case it will take reduce. I mean, it will take your time. So
Okay.
directly you can say the points. No need to mention in case of. In case of, just say abscess, localized, cellulitis, diffuse, abscess, central zone of necrosis, cellulitis, extensive necrosis, like that. So it will save your minimum 15 to 20 seconds.
Okay. Thank you.
Okay, okay, okay. What are the constituents of pus?
What are the constituents of pus? Okay. Pus is product of acute inflammation, uh, containing dead WBC, mainly neutrophil, uh, tissue debris, and pathogenic microorganism as bacteria.
Okay. How do you know which organism is the cause without any test?
Color
Yes,
of
by color.
pus.
Okay. Yeah. Finish.
Okay. Yes.
Yeah, the color. Which color will indicate what?
Uh, Yellow, uh, Staphylococcus aureus, green Pseudomonas, silver actinomycosis.
Okay. What are the causes of abscess?
Uh, Bacterial, Staphylococcus aureus, Streptococcus pyogen, non-bacterial, viral, fungal, parasitic.
What are the causes of non-bacterial abscess? Already
Fungal,
you answered. Yes. How to treat an abscess?
incision and drainage, and antibiotics and early start antibiotics according to culture and sensitivity report, according to hospital policy and after consulting with microbiologist.
Okay. When is antibiotic required for abscess?
Okay. uh, if there is extensive infection or cellulitis, Patient has sepsis after drainage, immune compromised, uh, and if cavity is not left open to drain the pus.
Very good. Which strain is used for tubercular bacilli? Which stain means would
Gel Nielsen stain and Oramine phenol stain.
okay. Zell Nelson and Oramine.
Oramine phenol stain. Yeah.
Okay. Okay, doctor. Thank you. Dr. Amir, you want to add anything?
For the constituents of us, yeah, Dr.
Yeah.
Khadija, you studied, but we need to direct you for the right answer because this answer is not accepted, the one you said, okay?
Part
For the component of bus,
component,
there
yes.
is, yeah, there is a new answer. You should say there is a fluid part and solid part. Fluid part consists of exudate of water, immunoglobulins, complement, and cytokines and clotting factors. For the solid part, it is formed of dead and live bacteria, neutrophils, macrophages, and dead human cells and fibrin network. This is a complete answer as the checklist.
Yeah, the
You
last
write it down, okay?
Please say again.
Again,
Solid part.
fluid part and solid part, okay?
Yeah. Solid
Then,
part.
yes, fluid part first, fluid part, then solid part. We have two parts, one fluid part and one solid part. Is it okay?
Yeah.
The fluid part consists of what? Exudate. Exudate of water, immunoglobulins, clotting factors, complement, and cytokines.
Clotting factors.
Complement and
Complement. Cytokine.
yes.
Thank you.
The,
Okay.
yes,
Uh,
the solid part still the solid part consists of dead and live bacteria, neutrophils, and macrophages.
okay. Solid part.
Dead and live bacteria,
Live
neutrophils,
bacteria.
neutrophils, macrophages.
Neutrophils. Macrophages.
Yes, plus dead human cells,
The human cells.
plus fibrin network. This is a complete
Lastly.
answer. Fibrin network, fibrin network.
Okay. Thank you.
You're welcome. There is something else. Uh, where is it? Where is the antibiotic which is stain? There is something else missing. What is the cause of bacteria? How to treat? Yeah, how to treat? How do you treat an abscess? Yes, you will, like we said, in any abscess, consider yourself in the operation room. You will say you will do what? Under complete aseptic technique, incision and drainage. Then you will send sample for culture and sensitivity. Then a complete drainage and cleaning of the wound. Then a sample dressing, and we will give him broad spectrum antibiotic according to the hospital policy and trust protocol. Mostly it will be flucloxacillin and waiting for the result of culture and sensitivity. Then we'll consult the microbiologist. Okay.
Uh, I will take the patient in operation theater with aseptic precaution. I will incision and drainage done, and antibiotic start according to culture and sensitivity and according to hospital policy after discussion with microbiologist. Okay.
Oh. will send the sample for culture and sensitivity. Okay, because this will take 3 days or 5 days. So you will send the sample from the bus for culture and sensitivity. Then you will give the patient broad spectrum antibiotic. Mostly in these cases, flucloxacillin, because most common organism is Staph aureus.
Okay. Okay.
Okay.
Yeah.
And after 72 hours, when the report will come, we'll check. If it is sensitive, we'll continue. If not sensitive, then we'll add the antibiotic after discussing with the microbiologist. Okay, then the next station you can take, Dr. Amir.
I missed this one. I didn't prepare it.
Okay, then I can try.
Okay.
I can try. Yeah. Male patient presented with left knee swelling and redness with a history of tibial fracture and internal fixation.
What is the investigation you will do for him?
As patient came with knee swelling, first I will do aspiration of the knee fluid.
Okay. You look for an aspirated fluid.
Okay, I will look for the color and amount and viscosity and turbidity of the fluid.
What tests will you do?
I will do culture and sensitivity. I will do cytology, and I will do gram staining.
Okay. You are given a pathological report showing proteins, cocci, and polymorphonuclear lymphocytes. What is your diagnosis?
As it is showing protein with polymorphonucleus and cocci, so it is chronic osteomyelitis.
What do you think the cause is?
Uh, Patient underwent internal fixation and are now presented with these symptoms. So it is due to implant infection.
Okay. What is the common organism?
Common organism is Staphylococcus aureus.
Okay. How is bus formed?
Okay. How is pus formed? Okay. After the pathogenic organism, especially in the bacterial invasion, there will be acute inflammation, and as part of the inflammatory consequence, there will be vascular congestion and exudation of the fluid, and with infiltration of polymorphonuclear cell.
Okay. I heard someone answering. He was one of the people answering.
Hello.
He said, yes, can you hear me?
Yeah, your voice coming broken now. Now okay.
Yeah. It's clear now?
Yeah, now clear.
Yes.
No.
I said before one answered this question in one of the mocks. It was a really good one. He said it is inflammatory response associated with infection and chiefly containing fluid part and solid part. Then you will say the components of the fluid part and solid part.
Ah,
This is how pus is
I was
formed. It
also
is
thinking if we, because it was the answer from here, this note, but not very satisfactory answer.
yeah,
Can you
yeah.
repeat?
So this one is better.
Can you please tell that?
It is an inflammatory response associated with infection, and then you will say what it consists of.
Is an inflammatory process
associated with infection.
related with infection. It is an inflammatory process associated with infection.
Yes. Then you will say the previous result, like it is mainly consists of fluid part
Consist
and solid part.
of fluid and solid part. Okay. Yeah. It is an inflammatory process associated with infection consisting of fluid part and solid part. In fluid part, like the before, exudate of water, immunoglobulin, protein factor, cytokines, and in solid part, live and dead bacteria and dead human cell, macrophage,
Neutrophil.
neutrophil, yes, and fibrin network. Okay.
Okay, next question. Why pus burst through the bone?
Uh, due to increased uh, due to increased interosseous pressure, due to increased osmolarity, uh, due to increased tissue breakdown, also due to formation of the large rounded uh, opening in the involucrum. This pus burst through the bone and it comes out.
You listen to the new MOOC.
No, no.
Okay,
Oh,
in the new MOOC, there is a big debate about this question. They were fighting and arguing because this answer is not accepted. I don't know why.
okay.
So they said we have to look for it, and I will give you the answer. But he didn't look for it, and no answer. For me myself, I made my search.
Mm-hmm.
I found I found something that is satisfactory for me. The cause will be progressive formation of granulation tissue, followed by constitution of scar tissue. And this is how the sinus will be formed, and this will lead to bursting of the bus, or the bus can find its way to the surface. Yes, I found it in one of the, I think,
Please
websites.
say again.
Yeah, progressive formation of granulation tissue.
Okay. Progressive.
Formation of granulation tissue.
Progressive formation of granulation tissue,
Yeah, followed by
followed by
constitution of scar tissue.
constitutions of scar tissue.
Yes, and this will lead to sinus formation.
This will lead to sinus formation.
And this
Then
is how the bus find its way to the surface. And this is how the bus find its
this one,
way to the surface.
and this is
Progressive formation of granulation tissue followed by constitution of scar tissue, and this lead to sinus formation, and this is how pus find out way to come out. Very nice. It is a nice answer.
and the must find, and this is how.
And this is how pus come out from the bone.
Yes.
Must
Yeah, it is a good answer, brother. Very nice one.
Yeah, because if you think about it, the bone is not like the skin. You can give this explanation if you are in the skin. If this abscess in the skin, yes, this abscess and inflammatory process will be causing thinning of the skin, and with increased pressure, it will burst, like
Hmm.
the abscess in your face or
It
your thigh or
acts like
anywhere.
any other soft tissue.
Exactly. But in the bone, it's a whole different story. Like I told you, now progressive formation of granulation tissue inside the bone, followed by constitution of
Constitution
scar
of,
tissue.
yes.
Yes, this will
And they will
lead to formation of a
sinus
sinus.
formation. Yeah.
Once the sinus is formed, خلاص, the pus will reach the skin and will burst through the skin.
Yes. Hmm. It is a nice one.
يلا, next question.
Why squamous cell carcinoma develop and consequence of event? Squamous cell carcinoma develop due to chronic irritation. Due to chronic irritation, there will be metaplasia, and from metaplasia, there will be carcinoma in situ, that is dysplasia, and from dysplasia, it will form carcinoma. Hello?
Okay, I'm trying to remember, because in this question he changed the word metaplasia. He said don't mention metaplasia and say hyperplasia. So chronic irritation will lead to hyperplasia. Hyperplasia will lead to dysplasia, then carcinoma. I remember, because before when we were explaining for Barrett's esophagus and how it will develop to squamous cell carcinoma.
Yes, that was also almost same explanation.
But because Barrett esophagus is a different story. The Barrett esophagus, the
Columnar,
epithelium will is
columnar will
exactly.
change into squamous.
Yes, and this is metaplasia. This is metaplasia happened there. But here, what he said, there is no step
Metaplasia.
of metaplasia.
It will be
There is
hyperplasia.
hyperplasia, then dysplasia, then carcinoma.
Okay.
ওকে, দেন হচ্ছে ক্রনিক ইরিটেশন, হাইপারপ্লাসিয়া, ডিসপ্লাসিয়া, কার্সিনোমা, রাইট?
Exactly.
Yes. Yes. Okay. Then name the protein deposit in osteomyelitis. It is amyloid AA in case of chronic osteomyelitis, and in acute osteomyelitis, it will be C reactive protein.
Yes.
Specific pathological name of pus around the screw or implant plate. It is biofilm.
ওকে, ডিফাইন সিকুয়েস্ট্রাম অ্যান্ড ইনভলুক্রাম।
Okay. Sequestrum is a dead bone which is separated from the bone during process of necrosis, and involucrum is a lamellar bone or a reactive oven type of bone which deposits around the sequestrum.
ওকে, টাইপ অফ ক্রিস্টালস ইন গাউট অ্যান্ড সিডো।
In gout, we get monosodium urate, and pseudo gout calcium pyrophosphate.
ওকে, টাইপ অফ অ্যামাইলয়েড ডিপোজিশন।
Amyloid is AA, then AL, and beta amyloid.
Okay, why amyloid cannot be removed from the body?
Because human body don't have a specific enzyme to break down this amyloid, and it is difficult for the kidney to excrete amyloid. Yes. You will add other points here, Dr. Amir. Why amyloid?
Wait, what did you say for the explanation?
I say simple too. The human body does not have the enzyme to break down amyloid, and it is difficult for the kidney to excrete amyloid from the body
Yeah, because it has large molecular weight.
because it has large molecular weight. Okay.
Uh,
Or because of can say breakdown because of their stability and ordered structure.
what?
Can you repeat, Doctor, again?
uh, Amyloid fibrils are very hard to break down because of their stability and ordered structure. Can I add this point? Why amyloid cannot be removed from the body?
I'm sorry, say it again.
Amyloid fibrils are very hard to break down because of their stability and ordered structure. Then a human body has no specific protease enzyme to break it. Amyloid cannot be excreted by kidney.
What I know is the failure of the has large molecular weight. It can pass through the kidney tubules. And for the stomach, it cannot be
Digest
break down,
completely.
but because we don't have the enzyme to digest it. And everyone approved for this.
Yeah.
We don't. Yes.
So
For just one thing for the amyloidosis, we have AL and AA and beta amyloid and hereditary also.
on
We have
hereditary.
hereditary. Okay?
So
Yes,
total
we have
four.
hereditary.
AA, AL, AA, AL, beta, amyloid, and hereditary.
Yes.
Thank you.
Next,
Now we have 7 minutes. We can. You want to take this one or this one also missed? These are
okay. A young female was cycling when she suddenly developed pain in her thigh. As soon as she put her foot on the ground, X-ray showed fracture shaft femur with hypodense shadow. What is the type of this fracture? You should say it is a pathological fracture. What is pathological fracture? It is fracture of the bone that occur with I don't remember this word.
without adequate trauma and is
Yes,
caused
without
with
adequate room.
and
Yes,
and caused with some pre-existing pathological bone lesion.
yeah, exactly.
Then
طيب, what are the causes of pathological fracture? We have osteoporosis, osteomalacia, osteogenesis imperfecta, Paget's disease of the bone, primary bone cancers or metastasis,
yeah, they
osteomyelitis also.
same answer, but they just made it in neoplastic and non-neoplastic. Neoplastic is a primary or metastatic tumor, and non-neoplastic, as you said, osteoporosis, osteomyelitis, osteomalacia, and Paget's disease. And
Yes.
yes, okay.
What are the most common primary sources for bone metastasis? We have the thyroid and breast and lung cancers. We have also the renal or kidney cancers, renal cell carcinoma, and the prostate carcinoma. Prostatic carcinoma. What's the name of brain tumor causing sclerotic metastasis? It's medulloblastoma. Fracture was treated with internal fixation. How to check for malignancy? Fracture was treated with internal fixation. How to check for malignancy?
So, bone
How to
biopsy.
check
Bone biopsy.
aspiration from bone marrow biopsy?
Bone biopsy.
What?
Bone biopsy. Bone biopsy.
Biopsy. Okay.
Okay.
Pathology results showed atypical bland appearance follicular cells. What is the probable location of the primary? It will be thyroid gland. A thyroid nodule was detected and fine needle aspiration was done. However, it has not been able to rule out or confirm cancer. Why? Because differentiation between the benign tumor and the cancer, uh, it depends on the biopsy or the, and fine needle aspiration is only checking the cells. So it's only checking the cytology of the place where you take the biopsy. It doesn't show you any invasion of basement membrane or anything.
Hmm.
You have the complete answer?
Yes, same, but in the end, they just said it is needed to be done histology because cytology is a follicular thyroid neoplasm. Uh, 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 to diagnose this one, we need histology, not the cytology, because FNAC is a cytology. That is why it was not confirmed.
Due to capsular and vascular invasion in follicular carcinoma of thyroid.
Okay.
What are
In,
the other cells?
in follicular thyroid neoplasm, malignancy is determined by capsular and vascular invasion, which need histology rather than a cytology to confirm.
What happened?
Are you there?
Yeah, I'm there, but why suddenly my screen gone? We have less than 1 minute. I'm making a new link and I'm sending.